Hey there, friends. Today, we're diving into a topic that might seem heavy, but is super important: the impact of chronic community violence on our mental health. So, grab your favorite snack and let's chat about how our minds can be influenced by the world around us. First up, did you know that community violence can really shake things up in how we cope? Some folks develop emotionally regulated coping skills, which is like finding your inner superhero when life gets tough. But others might find themselves on a different path, struggling with issues like anxiety, depression, or even serious conditions like bipolar disorder or schizophrenia. It's like a mental health roller coaster, and for some, it can lead to psychosomatic disorders or obsessive-compulsive disorder. Yikes. Now, let's talk about resilience. This is when people bounce back like a beach ball after being knocked down, while others might find themselves wrestling with psychopathy. It's a wild mix of reactions to the same stressors, and it really highlights how varied our responses can be. Speaking of stress, psychological trauma is a sneaky little gremlin that can tag along after experiencing violence. It can lead to post-traumatic stress disorder, where people might experience avoidance and numbing symptoms, hyperarousal, or even re-experiencing those intense moments. Talk about a mental tug-of-war. Then we have disruptive behavior disorders, which can also rear their heads in communities marked by violence. It's all intertwined, and it shows just how crucial it is to understand the link between community violence and mental health issues. This brings us to the big question: why is there such a need for research in this area? Well, understanding the etiology of mental health problems related to community violence can pave the way for better intervention services. It's like putting together a puzzle. When we know what the pieces are, we can create a clearer picture and help those who are struggling. So, in a nutshell, while the topic of community violence and its effects on mental health can be heavy, there's hope in resilience, the power of coping mechanisms, and the promise of research that can lead to effective support. Let's keep the conversation going and look out for one another.